Next, we'll talk about Glofitamab. So Glofitamab is given as an IV infusion. It is as well given up in step-up dosing. Difference here being Glofitamab is given at a dose of 2.5 milligrams on cycle 1, day 8, 10 milligrams on cycle 1, day 15, and then 30 milligrams is a full dose. It is also given with a pre-treatment of an antibody obinutuzumab. So those of you who have lymphoma, you've probably previously been treated with a CD20 antibody called rituximab. Obinutuzumab is in a similar class as rituximab, just binds in a little bit different location, but it is given as a pre-treatment in this situation to hopefully prevent incidence and rates of CRS and ICANS in patients prior to Glofitamab. As well as what we talked about with epcoritamab, patients also will get steroids on the day of the infusion of Glofitamab. They will get Decadron, typically at 16 to 20 milligrams. So that is fairly equivalent to the 4 days of prednisone because Decadron has a longer half-life, meaning it stays in your body longer than prednisone does. And so it will typically stay in your body for about 3 days. So giving you the equivalent of 16 to 20 milligrams of Decadron will stick around for about 3 days on the body. Again, if we look at CRS, we will see a different incidence of CRS. So unlike epcoritamab, which was on cycle 1, day 15, the highest incidence of CRS with Glofitamab was with the first dose, the 2.5 milligram dose that comes on cycle 1, day 8. Thereafter, you see a step down in the incidence of CRS, specifically anything higher than grade 1, which is important because grade 1 CRS, which is typically just fever, can be managed as an outpatient. You don't need to be admitted to the hospital for grade 1. For grade 2 or above, you typically will have to be in a hospital and observed, and other medications may be given. So in this situation, the admission will happen on the first infusion of Glofitamab, whereas with epcoritamab, it was on the last infusion where you get the full dose. This is with the first initial dose. So if you get treated with these medications, these are the differences that will need to be teased out when your physician treats you, and the days that you'll be admitted will be based on when the highest incidence of CRS can occur.